Well, everyone, this is the last part of the day, and I get to say goodbye to you all and to say thank you for joining us. Wow, the questions were amazing in all the sessions that I participated in, and I really, truly thank you for asking and making this such an interactive and engaging program. I hope you got what you were looking for and the value out of the time that you spent not only listening to the presentations and engaging with all of the clinicians, but also with each other. Because as I think we all know, being part of a community that understands where you're coming from, where you don't have to explain, you don't have to kind of give all the flowery stuff that maybe friends and family ask is just so refreshing. And so I would encourage you to do a couple of things as we close our annual 2-day patient conference. Absolutely thanking our sponsors and all of you that support our work, because without funding and financial support, we can't do this. You know, the technology, the time, the staff, it's really important. And I'd like to take an opportunity once again to thank everyone that supports our work, and for all of our industry folks who participated today in our experimental industry roundtable. Thank you for taking time, and I hope everyone found that valuable and interesting. We took a little leap of faith to bring that session to you along with some of the others, trying to mix it up and give you insight not only into the disease and have opportunities to ask your questions, but to provide you with some other information about what happens behind the scenes that you may not be privy to. So I hope you found all the sessions valuable. And a few more things before I let you go. Feel free to reach out to us at any point in time. We're always here. We'd love to answer your questions or provide you with support or point you in the right direction or connect you with someone. So, you know, again, we are here because of you. And at some juncture when, you know, as Dr. Jay Choi talked about in his talk this morning, you know, maybe someday we'll have a cure and there will be no need for the Cutaneous Lymphoma Foundation. And quite frankly, that would make me very, very happy. But until then, we are here to serve you and to help support you in however and whatever ways that we can do that. So a couple of things in addition to participating in our programs and our webinars, please join us for the monthly networking sessions. If you enjoyed connecting with other people today, first Tuesday evening of every month at 7 p.m., we host that kind of network environment just for patients and family members to engage and interact and share your experiences. And I'll even say that for those of you who are, you know, doing well, and it's so important for newly diagnosed people or people who are struggling or people that have not been able to connect with others to hear your stories, to hear how did you manage this? How did you ask this question to my physician? So you have valuable knowledge, experience to share that can help someone else along their journey. So I encourage everyone to join those networking sessions if you can. And if that's not your cup of tea, we do have our community connections, which we launched in 2020, you know, as part of, I think it was on our plate to do, but we launched it faster than we had intended. And it's our online platform. It's a private platform. There's no one else on that platform other than you. And it's private, it's secure. There's, you know, no opportunities for people to jump in and read what you've posted and that kind of thing. And I really encourage you. It's a way to connect with each other, share your experiences in kind of that Facebook-like type of technology environment. And we get to interact with you and get to share what's happening with the foundation and where we're headed. And I really hope at some juncture we'll be able to expand some of the offerings through that platform that give you more of a ongoing updates and, hot off the press kinds of things as we move forward and are able to do some of those things that are visions in my head, so that I can, I always feel like I'm so privileged to have an insider's view into the world of cutaneous lymphoma, whether it's research, clinicians, what's happening with drug development, what's happening with access to these therapies in the different countries, because these are not available everywhere. We have a lot of work to do to make sure that everybody, no matter where they live, has access to clinical trials and to therapies, both old and new. You would probably be surprised at what therapies are not available around the world. So we've got a lot of work to do there. But I really feel like it's important for us to bring all of that back and share it with you. So we're trying to do that in a variety of ways. So I encourage you to participate and join us in those different platforms and those different opportunities. Let's see what else. So we're hoping to be able to put our toes in the water for our first in-person patient education event in November. So stay tuned for that. We don't have details yet, but we're hoping that, COVID is behind us far enough that we can safely host an in-person program. And then next year, our 2-day program conference will be back in person. Don't know where exactly or how, but just putting the little thoughts in your head. So look for that. Don't forget to fill out the surveys and the evaluations. We read everyone, we take them to heart. And the program that you experienced this year was based on the feedback we got last year. So, if there's things that you'd like to see us do better, there's sessions, there's ways that you'd like to engage that we did not incorporate, let us know. We'd love to hear your ideas. And again, this program was a direct result of what you told us last year. So please, please, please fill out the evaluations. And just so you know, and I think Autumn said it earlier today, but everybody that fills out an evaluation and all of the scavenger hunt responses that were correct are going to get put into a hat, and we're going to pull out some lucky people to get some prizes in the mail. So you'll get a little surprise from us as a thank you, really, for your participation and your engagement. And, your engagement and participation really makes these programs worthwhile and valuable. And I know all of the clinicians and all of us here, the staff and the board, are just really grateful that y'all joined us, that you took the time. And it's just so delightful to see everybody, even though it's just on the screen. So let's see, I think with that, I don't think I forgot anything. I probably did. But I look forward to seeing all of you virtually or maybe in person, or have a conversation with you via email or telephone if we can. Please connect. Let us know what you're up to, how you're doing, how we can better serve you. So with that, I will close our 2022 2-day virtual patient conference with a big hug from all of us. Be well, stay healthy. Let us know how we can help and serve you better, and enjoy the rest of your Saturday and your weekend and your summer. And we hope to see you soon. So take good care, everybody. Bye-bye.